Hi, have you ever seen someone with a dark tooth? Or are you one of those patients with a dark tooth? I feel ya. It's probably not your fault that you have a dark tooth. You might have fallen or had an accident as a child and your tooth got dark over time. So let's explore why teeth get dark over time and what are the most conservative and modern techniques in dentistry to mask them. I will show you my own clinical cases as examples. The first reason why teeth go dark is due to trauma. You might have fallen and broken the tooth or simply been on an accident that damaged the nerve, the blood supply, and the surrounding structures of the tooth. And so this is the reason why your tooth got dark over time. The second reason why teeth go dark is actually a deep infected pulp structure inside the tooth and the need to do a root canal treatment. After the root canal is treated, once again the tooth is left without a blood supply and turns dark over time. Let's see the treatment options that we have in order to correct the color of the tooth. The first treatment option is called internal bleaching. And what this is we put a bleaching product on the back of your tooth and we leave it for a few days and the color of the tooth comes back to normal. So I'm going to show you a picture of a patient of mine that came in to see me about 8 years ago to treat a root canal treated tooth, so a discolored tooth, a front tooth. And you can see this is how he presented. And after the bleaching product was placed and the color of the tooth came back to normal, this is the photo. I have a follow-up from this patient about 7 years later, and this is how it looks. So basically the tooth didn't go back to being dark again in his case. However, there's always exceptions to the rule. There's always those teeth that don't bleach or bleach and then again during the course of 1 or 2 years the tooth becomes dark again. And I have an example to show you this. This is a patient that presented to me again about 7 years ago, and we did place a bleaching product on her tooth. We got it to whiten. However, after 2 years the color came back. So we decided to do a more permanent treatment. So what do we do next? That brings me to the second treatment option. The second treatment option to mask a discolored tooth is to use a dental material. The most conservative way is to use dental bonding or composite veneers to mask the discolored teeth, but also we can use porcelain veneers and it will mask the tooth quite well. I explain the difference between these two materials on a veneers playlist, so if you're interested, you can go watch it and find out more information. Now I have a lot of patients who tell me, oh, what about a crown? Can I just do a crown to mask my discolored tooth? Well, the answer is no. With modern dentistry and with the availability of all these newer dental materials that do wonders in color matching, we do not recommend doing an invasive procedure like a crown. For a crown, we need to take down at least 60% of your tooth structure. So if you still have a good amount of tooth structure left, then the crown is not the answer to mask a discolored tooth. The less invasive procedures are the ones that I mentioned in this video and the way to go. With that being said, I think you should consult the dentist and see what they offer as the options for treating a discolored tooth. This is all for this video. I hope it was super informative and I hope you enjoyed it. And I would like to know in the comment section below if you have a discolored tooth and thinking about getting a treatment. By the way, one last thing. If you try to bleach your teeth with, for example, Crest-White strips or any over-the-counter bleaching products, or even if you seek bleaching procedures at the dentist that are in-office procedures as well as at-home kits, these methods will not bleach your discolored tooth that has a root canal treatment or has gone through trauma. So, FYI, it's very, very specific the way we treat teeth like this.